Another patient noted that her migraines returned with a vengeance after she had a hysterectomy. So you came up with a new plan compensating her hormonal imbalance to prevent migraines. And I thought that was interesting because, again, what role do hormones play in migraine?
So for some women, estrogen plays a big role in their migraines. I always tell people that there's usually three facets in their life, three facets in their life where there can be some changes that are hormonal affecting their migraine course or character. And that includes when women start having periods, during childbirth, and also during the menopausal states as estrogen starts to fluctuate, and particularly when it drops, are times where your tendency to have attacks or have attacks more frequently can certainly increase.
Let's talk a little bit about Mercy's stroke program. Mercy holds an advanced certification as a primary stroke center, as designated by the Joint Commission in collaboration with both the American Heart and the American Stroke Associations. Now, that sounds pretty impressive. What does it mean exactly to be a certified primary stroke center?
Yep, so by the Joint Commission, they set out numerous standards, quality measures. So we align with those quality standards set out by the Joint Commission, like you said, in collaboration with the American Heart Association, ensuring that we are following the most up-to-date guidelines, so the guidelines set out by the American Heart Association, and we can treat stroke patients. With clot-busting medications, et cetera, we are certified to treat acute stroke patients.
Dr. Zheng, any thoughts on that?
Yeah, part of the statement is that it's a center that is staffed by stroke-dedicated professionals, and we are able to, in an emergent manner, diagnose and treat patients that come in for their acute strokes throughout the whole continuum of their hospital course. And we are able to provide thrombolytics or clot-busting medications that in some cases can really alter and give back function and then sometimes reverse the severe deficits of stroke.
We'll take one more short break and we'll be back for our last segment. I want to talk about the stroke program a little bit more.
Well, in tonight's Woman's Doctor, if you're a migraine sufferer, a new medication now on the market is intended to focus on those extreme headaches. Mercy Medical Center neurologist Dr. Howie Zheng says for every 3 or 4 female patients, he maybe sees 1 male patient suffering from a migraine. In the last few years, there's been a new class of drugs targeting migraines. They're called CGRP antagonist drugs.
It's a natural protein or substance in the body that is utilized in a lot of pathways for inflammation and pain generation. And the reason why these drugs have come out is there's been a lot of research about blocking them, as they are usually produced in high amounts during migraine attacks.
Some of them are called Qulipta, Nurtec, and Ubrelvy. Dr. Zheng says some of these drugs have shown they can prevent a migraine. Some common triggers of migraines are stress, lack of sleep, dehydration, hormones, and even not eating.
And we're back. There's been some new research from the American Heart Association that shows the rate of stroke has been steadily rising among Americans younger than 49 over the past 30 years. Now, why is that happening? Is it not enough exercise, too much time spent in front of computer screens, bad diet, substance abuse, stress, genetics?
I think there's, with stroke, as with a lot of disorders, it's multifactorial. When we educate the population and our patients about stroke, we always go back to harp on risk factors, things like high blood pressure, high cholesterol, diabetes, smoking. Obviously, there are some that are non-modifiable, like aging. But I think if you take a look at that and you take a look at how we're doing as a society and as a population, you'll see that there is a trend towards a more sedentary lifestyle. We are having high rates of obesity. Our diet is probably poorer. We're having more sugar, processed foods in our diet, and I think less exercise. And the other thing that I'm also big on is if you look at sleep quality, sleep length, that has also decreased over time, as we enter into the technology age. And those all have major impacts in function and health and also stroke risk.
Jocelyn, what is the Be Fast test?
Yes, so Be Fast is a quick test that we educate the public, our community on the signs and symptoms of stroke. So if you think B is balance, is the patient off balance? E is eyes, looking at their eye gaze. F is face, do they have a facial droop? And then A and S are speech, and then good old T is for time. So educating the public that time is brain. We can give those thrombolytics or the clot busting medications up to a certain amount of time. It's really important to come in. So it's a quick mnemonic to teach the public so they can recognize whether their family member or their self is kind of having a stroke or signs and symptoms of stroke and should call 911 and present emergently.
Anything else you'd like to mention about the program that you think our viewers should know?
So we first were certified by the Joint Commission in 2007, so we've been doing this for a while, and as advancements come out with stroke, we are situated between two comprehensive stroke centers, and that means that they can actually go in and retrieve the clot. So although we are a primary center, which means we can give those thrombolytics, we do have two very close nearby centers that can go in and actually remove the clot. And we have a great working relationship with both of those.
Super. Well, Jocelyn, Dr. Zheng, I'd like to thank you for your time and your candor. I'm hoping our viewers enjoyed this chance to get to know you a little bit better, hear your stories, and maybe learned a thing or two that they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. Until we gather again, may the road rise up to meet you. So you made it all the way through the credits for Wait Doctor, I Forgot to Ask. This is where we briefly discuss the question each provider wishes their patients would ask, but don't, or the most unusual hand on the doorknob question posed by a patient at the end of their visit. Dr. Zheng?
I've actually had this asked a couple times. There's a patient that has asked it recently that stands out, and it's a stroke patient, and she's actually had, unfortunately, a number of TIAs and then eventually had a stroke, and she asked, what should I do if I have some of the stroke signs and symptoms and I'm at home, right? And the issue was, in one of her previous admissions, she, I think, called her son and then tried to drive herself to the hospital, and unfortunately, had missed the time window in which you're able to give, the clot busting medication. And I always tell people, if you really think you are having a stroke and you're having these acute symptoms, first thing to do is call 911 so that we can get you here as soon as possible and get you at least the opportunity, if you're presenting within, an early time window, to get thrombolytic or clot busting therapies. And I think, as the old adage states, time is brain. And I always try to remind people that, every minute that you're waiting, you're losing brain tissue. So action is very important. There was an article in the Journal of Stroke almost 2 decades ago. It's called "Time is Brain Quantified." And I'm a big numbers guy, I'm a big statistics guy. And one of the numbers or statistics that they had mentioned in the article is that for the average stroke, every minute you lose 2 million neurons, right? And so for some people, it's, what does 2 million mean? How many do I have? And where does that fit in? And I think later on in the article, they have another, kind of fun fact or statistics, which I think really drives it home, is that if you look at the normal rate of atrophy or wasting of brain tissue just through aging, on a year-to-year basis, the amount of neurons or brain tissues that you lose during a stroke within a minute is somewhere comparable to 3 to 4 years of normal aging. So I think once you put that in perspective, that really drives the point home.
Interesting.
Yeah, I would think the biggest thing is for patients to ask, like, what can I do to decrease my risk of stroke? So, as providers, of course, we're looking at blood pressure, cholesterol, exercise, all the things that we've talked about in this segment, sleep, limiting the amount of technology, that's a lot and overwhelming for a patient. So before they even get to that question, I ask the patient, what is the one thing that you want to work on? So what do you want to work on out of the things that we listed that are risk factors for stroke that you have? And then when they come back, well, what's the next thing? Because obviously it can be very overwhelming for a patient to have all those kind of things. So I think the question that I like to hear from patients is, what can I do? And if they don't say that, then I say, this is what we're going to work on together. Because again, if we can make in baby steps, if you give a laundry list, it's just too overwhelming, and then you're not going to get any success. So, working on one thing, they improve that, they come back, maybe their blood pressure looks better. Then we're going to go on and move on to cholesterol. So as a patient, what can I do to decrease my risk for stroke or a recurrent stroke or TIA?
Great. Thank you both.